All right. So yeah, this is because I don't really know exactly when we go live. So like,
I'm refreshing the page right now.
I did go from the YouTubes. If you wanted to share this out, that would be fantastic.
Yep.
So we are live right now. I wanted to do up front a quick non-political PSA. So you can share this out to your friends. It doesn't matter if they're what political leaning or no political leaning they have. And we can get on to discuss the ramifications, stuff like that in the back end of the show, and we'll let people know when that's going to start if they don't feel like hanging out for that. So this virus is very real.
Wait,
what's going on? Yeah, the coronavirus, as it turns out, is entirely, this is a thing that's happening, right? For context, Governor Cuomo in New York basically came out yesterday and said that with the cases that are out there right now and the fact that there's a 2-week delay because, that you can be walking around for up to 2 weeks asymptomatic, not getting tested. And because of the lack of testing, they don't know how many people are sick there. And they can use China as an example. They can use Italy as an example. Italy's probably the closer one because of the lack of attempted mitigation attempts early on, right? And the biggest problem is not that we're all going to die. In fact, 98% of everybody that you know is going to be completely fine, right? Like that, it's not one of those pandemics. It's like, oh my God, like everybody around you is going to die and turn into a zombie. That's not where we're at. But the numbers are still terrifying. So for context, the real problem is when everyone gets sick with this, 10 to 17%, it's actually 17% in New York right now. 17% of the people that test positive for this virus end up in the hospital and a lot of them need ventilators. They need, and this number is true, approximately 1,000 times more hospital capacity than they have, right? Like somewhere between 100 and 1,000 times. That's why Governor Cuomo is asking for the military to come in and build hospitals. This will be all over the country in less than a month. It might even be like a matter of weeks. So I want to offer that as context so that you understand why I want to urge everyone to act like they are in fact themselves infected. If you are infected, you won't know it, right? You might not know it for a week. And while you're not going to probably go into to some giant group of people, you could pass within 3 feet of someone who will, right? Who's just going to be a Devin Nunes. Sorry for getting political for a second, but the motherfucker's telling people to go to restaurants like as of yesterday, which is crazy. So we all need to get through this as quickly as possible. If you have grandparents, if you know anybody who has grandparents, they are the ones who are going to pay the price for this, right? If you're over 60, that is a huge marker for mortality for this. If you are immunocompromised or know anyone who's immunocompromised, this is why you have to act as if you yourself are infected right now. And you probably aren't, and that doesn't matter, right? So when they start talking about social distancing, what they're really saying is you have to stay in your house, right? There are 7 million people in San Francisco under full lockdown right now that are not allowed to leave their houses for 3 weeks. And they actually have to call the authorities if they want to leave their house, right?
It's 6 counties around San Francisco and surrounding counties.
Yeah. And that I didn't know this until this morning. 7 million people.
Yeah.
Right. Which is crazy. And, the experts that I've been looking into are all saying that the really smart thing to do would be for the entire country to do that now. Now is the time to overreact, right? And it's going to feel like overreacting. And that's awesome, right? Because if we get to the point where it feels like we're reacting appropriately, we're actually going to be much too late, right? To save as many lives as could be saved. So the social distancing thing is massive. If you have to go outside 6 feet away, gloves help, but not as much as you would think. The virus can live on different kinds of surfaces, but actually not for that long. Cleaning all the surfaces in your house will definitely make a difference. Again, the hand washing is amazing, but please understand that this is an aerosol virus. That means that just breathing next to someone, you could pass this virus to them. You don't have to be sneezing. You don't have to be coughing. It's literally, you're able to infect other people before you have any symptoms at all. And it's literally just by sharing air with people. So that's something that is really, really important to know. Kids can get it. And they will absolutely unless they're immunocompromised, like seriously immunocompromised, like with leukemia or something like that, they're going to be fine, right? Which is great news, except that they're walking petri dishes. No offense to your kids. And, if you're around them, the likelihood is that you will get it. And then again, you could go up to 2 weeks, going around very, very innocently and going around anyone that might then be working at an ALF for all we know, right? So that's, again, why this lockdown, while it sounds, sort of draconian, is so important. Like this is what we're sort of given to do. And I want to get into some of the myths that that have been going around. There's actually one I was talking to. I've been talking to Popeye again, which is never.
I don't even know why you do that.
Down. He's being all right. I love leaving the door open, man. It's sort of something that I got to do. Oh, so he was saying that if you had
some information might get in, you don't want to be careful there because.
Yeah, right. So he asked, he said that a lot of people are saying that if you've had the flu before, that's actually it's going to help you not get this. That is categorically false. Right. There is literally no truth to that in any way, shape, or form. So that's not going to help. Just in case anyone is asking about that specifically. Somebody on our show asked about mosquitoes. This is not mosquitoes are not a vector for this. It has absolutely nothing to do with it. One of the other ones is the weather, right? Like, is it going to track with heat? So right now, there is absolutely no correlation with warmer temperatures and this virus spreading less. None. It is not a thing. And in fact, even if it was a thing in the southern hemisphere, the virus would still be gaining strength down there, right? So it's kind of wrong twice. Is there anything that you can think of off the top of your head?
Okay. Hot water and saunas.
Yeah,
I'm seeing the thing. If sauna heat will kill the virus, drinking hot liquids will kill the virus. No,
right.
Neither of those things is true, and no less an authority than Dr. Fauci, who is leading our national response to this pandemic, said so yesterday on live national television. Saunas will not help once it's in. Once the virus is in your bloodstream, hot liquids are not helping.
Right.
If it's in your mouth,
not
it's
even in your
bloodstream.
That's the thing. It's in your cells. Like once you have it, it's not like lining the area of your throat. It's in your throat cells. Viruses are super, super tiny. Yeah. There's a doctor, Fahim Yunus, on Twitter that had some of these things with the summer thing. Oh, myth number 3 was if you can hold your breath for 10 seconds without discomfort, you don't have COVID. That's not a thing at all. Most patients with corona.
Let's talk about the specific thing that is missing is that people are asymptomatic for 2 to 14 days. So holding your breath, that right. If you're sick, I can maybe understand how you might come around to the idea that if you that would indicate respiratory distress. However, if you're asymptomatic, you're asymptomatic.
Right.
Holding your breath is normal when you're asymptomatic.
So even when you're symptomatic, young patients with coronavirus will be able to hold their breaths for much longer than 10 seconds. And many elderly without the virus won't be able to do it. Right. So it's not a way to track, that.
That indicates to me like that's part of the problem with the lack of testing is people are trying to find ways to divine is the right word, whether they've got the disease or not.
Right. That's not going to do it.
It's not going to happen. Yeah.
And again, do not go to the hospital if you think you have it. Call your doctor.
Right.
That's critical. I mean, just think about it this way. All hospitals and doctors' offices right now are high likelihood for actually getting it. You're walking into an area that could be infected. And again, just as a personal responsibility thing, I want us all thinking in the context of you are actually infected right now and you don't know it. Right. That's
let's
probably not true.
Who that would have kept safe yesterday. We had an ALF here in Pasco County that was allowing visitors still. If you are positive and asymptomatic and went to visit your parent or grandparent in that nursing home yesterday, you may have killed a bunch of elderly people. Right. So assuming that you are positive today, ask yourself the question, who am I willing to infect when I leave my house today? Because that's essentially the calculation we all need to be making every day. And I know that sounds draconian and severe, but that's the truth of it. I have to go to an office today and meet with clients.
That's how we stop this.
Yeah.
And just for context, nationwide, if we weren't to do any of this, the minimum would be 1.4 million fucking dead people.
Mm-hmm.
Let me say that again, 1.4 million dead people. Now, the flu kills about 30,000 people a year. Right. At the very, very, very best with this coronavirus, we're going to keep it down to about 250,000. That's like everyone gets in their house and stays there right now. So, we've got a chance to save 1 million people which is why I keep ranting and raving about this, and I'm not going to stop. Right. I see a train coming at my family and my community in this country, and I'm not going to sit by and not tell people about it and scream it from the rooftops until people get it. Like I have a moral and ethical duty to do that. Now, granted, we're also going to talk about things that you can actually do and create a bunch of agency. Again, like Greg said it best yesterday. I'm going to keep using this because it's fucking brilliant. This is kind of our World War II moment. We have to mobilize to make more stuff. We got to we as a country, we need to mobilize like it's World War II. But really, all they're asking us to do is sit on our fucking couch. That's it.
I mean, yeah.
It could be worse, like a lot worse, a lot worse.
Okay, Boxer Cat, that's our friend Elizabeth Wood. She has a question. Corey, would you address a topic for me? I've been told that instead of, quote, all of us losing our jobs, end quote, the high-risk population is who should stay home.
No, absolutely not.
Why not? Well, okay. I think she's looking for a way to argue that. Right?
We can definitely unpack it. So you don't know necessarily who is high risk all the time, right? And you don't know if you're passing a nurse on the street, right? So if only higher risk people were sort of quarantined right off the bat, any person that comes into contact with them at all could kill them, because that sort of presuming that we're all going to get sick. And there's a decent percentage of people that are not higher risk who are also going to die and need hospitalization, right? Of those 17% of the people that get infected that need hospitalization, half of them are young people still.
That's been missing from our discussion of this story.
Right. And so if only 30, 40, 50-year-olds who need hospitalization, just to get rid of the high risk population completely, never mind, just put them in outside this box for a minute.
Yeah, don't put them in a box.
Don't put them in a box just yet.
It's language we don't want to use just yet.
Good call. There would still be probably 10 times more people that need hospitalization than would get it.
Right.
Like if everyone does nothing, everyone's going to get this very fast. And that's when they talk about like limiting the curve and that kind of thing. It means like a lot of people are still going to get it, but it's over a longer period of time. And those people will be able to get treatment because the hospitals will be less overrun. Like hospitals getting overrun is the fucking problem. There is 160,000 ventilators in this country, and we need about 3 million.
I want you to think also about the number of people who don't have access to healthcare, who may not know they are high risk.
Yeah.
May not themselves be aware that their risk factors are high.
Yeah. So
undiagnosed high blood pressure, undiagnosed autoimmune problems. So yeah, no, that's not an acceptable answer.
So this is one of the myth number 6. All this social distancing is an overreaction. You'll see that the virus won't cause much damage. If we don't see many infections, I hope will prove that social distancing worked. Not that the virus was never a big deal. That's true. Like, again, if we overreact and nothing happens, that was the whole point.
Right.
Yeah. So myth number 7, car accidents kill 30,000 a year. What's the big deal with COVID-19? And I see this in the form of like COVID-19's only killed a few thousand people so far. Why are we worried about this? Even from John McAfee, who's like an encryption expert / now coke fiend, but we'll blow past that one. You're missing that this is an exponential curve, right?
Yeah.
Like that we're still at the beginning of this. Go ahead.
I've got a graphic to share real quick. Let's make sure I do this correctly. Not like yesterday. There you go. So the purple line is confirmed cases, and we back up here to March 4th. Which is 11 days ago now, 12 days ago now. Look at what happened from between March 9th, and today, right? That's where we are. And so at the end of a year, 30,000 deaths by automobile, right? But we're not near. We're in the first 9 or 10 days of this really beginning to expand. So the number of total cases is going to be much larger than the total number of traffic accidents. That seems likely. And therefore, the number of people who die from this is going to be much higher than the percentage of people that die in car accidents.
Yeah.
So it's
going to end up being about 7 times worse than that at the best case scenario.
Yeah.
One of the other myths is hand sanitizers are better than soap and water. That's categorically false. Soap and water actually kills and washes away the virus from skin. It cannot penetrate our cells. Plus, it also cleans visible soiling of hands. Don't worry if Purell was sold out at your supermarket. Myth 9, one of the best strategies to prevent COVID-19 is to clean every doorknob in your home with disinfectants. Wrong. Hand washing, maintaining 6-foot distance is best practice. I'll say that again. Hand washing and maintaining a 6-foot distance is best practice. Unless you're caring for a COVID patient at home, your home services should not be at risk. I didn't actually read through that one. That's a good one. Anyway.
Yeah, I did see a great meme about this. It's Wesley Crusher asking Captain Picard, why are there no doorknobs? Picard has to say, let me tell you about 2020, Wesley.
That's exactly what it was. And of course, myth number 10, COVID-19 was deliberately spread by, depending on your politics, the American or Chinese military. And all he said for that is, really? With a question mark?
Wait, what was the myth again?
Depending on your politics, that either the American or Chinese military deployed it.
Please, let's stop talking about that.
Yeah, just shut up. So Andy Slavitt was, I'm actually going to get his actual creds, former Medicare, Medicaid, and ACA head for Obama, founder of U.S. of CARE and some other stuff. Obviously an intense expert. He's been calling around to people like crazy. Very worth following on Twitter. It's A Slavitt, so ASLAVITT. His daily updates are, well, it was reading one of his first daily updates that took me from like the oh shit that I was at after listening to the virologist expert on Rogan, after already being pretty worried, to like oh shit.
Yeah. Okay. Donna says all of her communities, she works for a pretty large nursing home concern, are COVID free.
You don't know that at all.
Big asterisk, because
that's the thing.
How many of your residents have been tested?
Almost certainly less than 1%. That's the thing. You have to act like they're all infected because you have no idea. That's a fact, right? Yeah. The amount of testing that we've done so far is, Canada so far has done 10 times more testing per capita than we have, right? And right now South Korea had their first infection the day that we did, and they're testing 15,000 people a day. Right. We've tested about 15,000 people total. Right. And that, we started getting worried about it at least 2 weeks ago because there was actually cases confirmed showing up there's cases around us now. You have to assume that in Pasco County, there's hundreds to thousands of cases right now. Right. You do not know that it's clean yet.
And I think people are now seeking panic testing if they're having any symptoms at all. And that's probably a mistake as well. Right.
And there's going to be triage for that. And what's getting established for the triage around that now is getting better. Before it was like, you have to have been in China. You have to have been, in contact with somebody who's been tested or whatever. Like, they do have to prioritize it because it's taking them time to ramp up. That's something we just are going to have to live with now.
I would like to remind people that even today, when the Florida Department of State website has gotten a lot, or Department of Health website has gotten a lot better, but it is still listing Florida as community spread unconfirmed.
Yeah, I think that's
just probably inaccurate. I think that's highly unlikely.
Yeah, it's completely inaccurate. So for yesterday, he's actually been doing one of these a day, which is incredible. So Andy Slavitt's update, I'm just going to read through the whole thing if that's okay. In fact, I think I'm actually going to throw it up on the screen because there's some fancy shit.
Cool. I got a couple of comments I want to get to. Sherry Burney. Good morning, Sherry. Remember when everyone said that minimum wage didn't need to be raised because anyone can flip burgers, and now minimum wage workers are forced to continue to go to work every day because they are considered essential? Yeah, back in the quaint days before.
And honestly, like, this is a perfect proof of why everyone should be thinking in terms of UBI, not minimum wage.
Yep. Boxer Cat, the person who made the argument is highly financially motivated due to working in the service hospitality industry. It hurts my heart to think of someone being this self-centered. Our governor is a pretty good example. He spoke all day with CEOs of food and bev companies and then did not institute closures yesterday. So they're thinking about the economics of this, not the human cost. Boxer Cat, Italians would argue it's a bad virus, I think. You're right about that. Yeah. Ginny, Bath and Body Works is closed in all U.S. and Canada stores. That's a great idea. I'm glad they did that.
Yeah.
Let's see. Dave Meyer says, should probably point out that all these graphs and numbers are actually meaningless because we aren't testing even a fraction of a percent of the amount of people that should be. I think I agree that we're blind without more testing, but at the same time, I think the moment for that to be a thing that might happen is gone. I don't think we're going to be able to catch up with the testing curve now.
Well, I think that, and the main thing South Korea is saying is that because of the limited resources, you can't plan and send the resources where they need to be if you aren't testing. Right. There's going to be hotspots, and those hotspots will be rolling, right? You'll have a hotspot here for a month, and then you'll have a hotspot there for a month. You need to be testing at scale, like obscenely. We do need to get to the point where anyone who feels like they want to test gets a test. That because that's gonna be able to allow us to target all the resources where they need to get targeted. But you're right, as far as like containing it, that ship has sailed. So for this March 16th update here. So I'm going to try to have some positives in here. Yesterday, he had none, but also present the facts of what is around the corner. This sums up what I know from the administration, states, manufacturers of gear, hospitals, and major tech companies, and it's only 4:30. Last week's issues, like lack of testing, are being discussed and addressed, but it is taking time. There are more reagents being made. It will still take weeks to get them. Now swabs are running out. Okay, people working on this, but there isn't enough supply around the globe, right? It's not like you just could buy stuff from other countries because it's going to be affecting everyone. And everyone around the globe is competing to buy the same products, but swabs is only the beginning of the problem. Every supply needed to keep our frontline healthcare workers feeling safe is tied for my number one concern. Experts tell me we need more than 1 billion with a B, N95 masks. I don't know how many we have today, but I suspect it's less than 10% of that capacity. Let me explain what's going on. A whole number of factories closed over the last few years that were making masks because they were too cheap. So good news is there are a number of empty factories to be brought on. Two, China has repurposed shoe factories and other factories. We haven't. Three, a fine mesh fabric is required. A special machine is required. These take months. Four, but the current mask producers could make more, and there are some dormant factories. The government must tell them now that they will pay for them. This matters. Doctors in Denver, where the virus hasn't been yet, say they are almost out of masks. A nurse somewhere else, can't say, told us that her staff isn't being given sufficient masks. She's president of the union. I talked to the CEO, who said she had no good answers. We need an all-hands approach to make our frontline healthcare workers, nursing home staff, and docs feel safe, period. If not, they will agitate and many won't show up. People who can change this are aware and need to step up. And again, that frustration is entirely understandable because they're putting themselves on the front line. Right. I have another call to action. Attorney generals across the country and at the Justice Department must immediately go after and prosecute profiteers. They should start with Trump. This is non-political. One highly reliable and very well-known person told me he received an offer to sell him 1 million masks. People are selling them for $200 a piece on Amazon. And we regular people do not need them. Let me read that again. We regular people do not need them. Do not buy them. You need healthcare workforce much more. And the whole point is the masks keep the virus in. That's their main job, right? The masks keep the virus in you if you're sick. It is still entirely possible to be wearing the mask and become infected. That's just not how it works. That's why we have to save them for the people that are going to need them. The issue of hospital capacity is a real problem. I will share this now pertaining to New York because Governor Cuomo shared these numbers today. Brace yourself. The green and yellow bars are how many ICU beds with vents are needed. See the little red line? That's how many we have. I'm just going to leave this up here for a bit.
And that's just for New York City.
Mm-hmm.
One of the best healthcare markets in America as far as hospital quality and healthcare quality.
Yep.
That's an exemplary system in America.
And note, this is by the end of March. This is not 2 months from now. This is 4 weeks from now. Not even 4 weeks from now. It's freaking 2 weeks from now.
Yep. 17th today.
Anyway, carrying on. So that's a thing.
All right. So got some more comments I want to get to while we're doing this.
Go ahead.
Not to mention the spread to people who are in ERs and clinics for normal everyday stuff, and a COVID patient comes in for testing. Testing needs to be separated from normal ERs, clinics, etc. They are setting up tents in parking lots at many hospitals to try and keep that outside. Isolation units are starting to happen. That's good, but they hadn't been till this week. That's not good. Let's see. There's some talk about I think Sue's daughter's in a sports ball college tournament of some kind. Colleges are closing, telling kids to go home. Kids that count on housing on their campus don't have anywhere to go. That's a problem. International students that are being told to travel back to their country of origin, if it's a European country, that's now a problem. So Dave Myers, if I lived in Broward County, for example, and I have an elderly person that needs stitches, do I want to risk going to the ER for fear of COVID patient being there waiting for testing? These are all good questions. You call, right? I think that's the baseline advice is you call. You call your primary care physician. You call your local health department. You call the state of Florida has a hotline.
Yeah.
You call the hotline and you ask what you should do.
And
if it's,
especially now,
if somebody's bleeding to the point where you think that, it's going to,
you have to go.
You have to go.
And what I would do is probably stay in the car and have them come to you and direct you to where to go. Yeah. And again, right now, especially because there's so much confusion in the populace, right? Like people will still be going to the ER, even if they're told not to. And again, I think the ER is going to start getting really, really good, really, really quickly. An ER doctor in New Jersey and one in California are both in critical care right now because they didn't get this started in time. So I would imagine that, that I know the VA, they've started that already. So I think like by next week, this won't be a problem. I think they're going to have protocols for this and people will understand them. But yeah, right now it's a little dicey. So just for some good news, one tech company is undertaking an effort to build 100,000 ventilators in a month. Good on them. Apparently it's somebody's birthday. Yeah, so there's 30 things in the USA Today piece. I'll throw the link to that in the comments. It's actually by a bunch of doctors, super smart stuff. Basically outline some of the things we've been talking about if you need to share it to somebody. So yeah, the masks thing, blah, 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 blah. Anyway, so that's just some of the details that were coming out. Again, testing, they're starting to ramp it up. Yes, it's late, but better late than never. And I think they're getting the scale of what kind of an issue this is going to be. They are, of course, lagging 2 months behind on everything, right? So we could have been doing this for 2 months and they're not. And of course, the next thing is going to be the fact that all the medical gear is going to run out really quickly. And again, that's exactly what happened in Italy. That's when one of the hospitals is like, wait a minute, all of our rooms are full and we don't know what to do. And then they asked the virologist that's probably been screaming at them the whole time. The next day, they shut down the northern half of the country. And when they realized it was way too late, they shut down the whole country. So when that happens here, it'll happen overnight. Like it's going to happen really, really quickly. So just to start preparing people for that.
Right. Well, yeah, I want to try not to get ranty.
Okay. So here's the thing. That was the PSA. We kept it mostly apolitical. If you don't want us to tell you that your vote for Trump was a fucking nightmarish mistake, turn this off.
I don't want to just talk about Trump here.
Any Republican, basically.
0 of my local county commissioners have appeared on social media or on video to talk about what we should be doing. 0 statements from our county health department officials who are overseen by the county commission, by the county administrative staff. 0 statement from our state legislator, Amber Mariano, on social media about what to be doing and what she's doing to help. 1 statement from Gus Belarakis about how awesome the federal government response has been. So yeah, he was very excited about the relief bill that was passed yesterday, but nothing about coordinating with our local health officials. The state of Florida has done a pretty good job on the COVID response website, although I really, really doubt their numbers in Pasco County. I'm finding it hard to imagine there are only 2 cases in Pasco County at this point. That's been the same for 5 days, and nobody else has a curve like that, so why would we? But our local health department COVID website or COVID page has not been updated in a week. That's unacceptable in this moment. That's not okay. So there's that. Let's see. Maria Richards. My husband was standing in line with a nurse at Publix with protective gear. She told him she had the virus but couldn't say which hospital she worked at, so she went to the grocery store.
What?
Mike Silvestri.
Hold. What?
Yeah.
No, I didn't. Please repeat it.
Maria says, my husband was standing in line with a nurse at Publix with protective gear. She told him she had the virus, but couldn't say which hospital she worked at.
I mean, yay for protective gear, but people need to fucking get their shit together.
Michael Silvestri, I have friends that work in infectious diseases at Brigham's and Women's Hospital in Boston. All I'm permitted to say is to listen to local healthcare professionals. Do not listen to federal government statements. Yeah.
Yeah. I mean, just go watch that whole Cuomo presser that he did. I mean,
that's how we should all be acting.
100%. He said, like, once you understand the beds to the amount of beds that we're going to need, you're going to wake up in sweats. You're going to have a panic attack and you're going to be right. I think that's verbatim.
Yeah. Donna says, so who is ownership on the phone with every day? Good question. How are they confidently predicting that your entire chain of homes is COVID free? I'm curious about that. There's a difference between not knowing that there's any cases yet and declaring that you don't have any cases. Silvestri, there are systemic issues as well. I've been thinking about this. It's an American mindset and attitude that is also contributing to the problem. Things need to change from the bottom up. That includes us. And I saw a shit ton of pictures from Clearwater Beach yesterday, packed with people. They're not allowed to go to work, so they're social distancing by going to the beach. Okay, how many of them stopped at Starbucks or to get gas or at 7-Eleven on their way to or from the beach? 80% of those people probably stopped somewhere else on. It's not like they hermetically sealed themselves in their car to get to the beach. And the beach was crowded. That's not a good look for us. And I've been thinking about places like Florida, where we have an inordinately large amount of gun-toting, meat-eating weirdos. And if we do end up going into a quarantine situation where we're all told to stay home for 2 to 3 weeks, the confrontations between roving, patrols of police officers and those people are going to be problematic. And there, that really concerns me. That rugged, individualistic. I'm, riding around with an assault life sticker with an AK-47 on the back window. My pickup truck guy meets a cop who is telling him he has to go home and stay home. I'm worried about those interactions. I'm worried about our propensity to ignore good advice like this because we're Americans and we're somehow special. So, yeah, I am concerned about that. Half of 1% of the U.S. population is 1.6 million. If these people need hospitalization, where are they going?
Well, and around these numbers, what's 17% of 40 million? No, 40% of the country.
Yeah, 40% of the country is 150 million?
Yeah.
Thereabouts, 160
million? What's 17% of that?
Eesh. Yeah,
cool. I mean, that's the thing. Like this is why it's perfectly reasonable to lock us all in our houses without exception. And people will still get sick, and family members are still going to get sick. And that's literally, I was listening to an epidemics expert yesterday. I was talking to Chris Hayes or something. And Chris Hayes brought that up. Like, what happens to those households, like that you're locking people in with or whatever? It's like, honestly, that's the price we have to pay. And he's right. Because the maximum number of people who will get infected in like a family of 4 is 4 people.
Yeah. Gun sales have been crazy. Yeah. There's a really good AP explainer article. That's where that graph came from that I just posted a bit ago showing the curve. I'm going to go ahead and post that in here. There's a quote from a gun shop owner says, it's been crazy in here and it's like everybody's preparing for the zombie apocalypse. Like, funny, I've been saying for a year or so now that all these communities getting built with walls around them. This is that survival fantasy, the zombie survival fantasy, except it's not zombies, it's poor people and sick people. And I think that's why those shows have been so popular, is because they prey on that part of our mind that is really literally afraid of what's happening right now. And I think more people are going to get shot. So grocery and convenience store workers still got to work. They're going to need extra compensation. Yep, agree with that. People at my job were showing me on their phones their guns they were planning to buy. Okay.
Yeah,
this is we're at that please don't go outside and shoot at the hurricane moment.
What's really sad, Greg? We're not there yet. Just got a video saying that the virus dies at 133 degrees. Anyone know about that? I think it's 180, and there is like that. So this is what, and Rogan was asking about this. So if you have a really hot beverage, for example, and you drink it, it's going to like kill all the virus in your throat. A, the virus is in your cells, not on the surface. It's not going to work. And B, you actually have the virus all over your body, so it's not going to work. And C, the second you put it in your mouth, it's actually mixing with the temperature that's in your mouth. If that was actually the case, you would burn the inside of your mouth pretty horribly. So that's not going to work either. And then that's where the sauna thing came in, right? If you have the sauna that is really, 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 really hot, the second that you breathe that in, it's actually mixing with the air that's already in your lungs and becoming much, much colder. And if it was warm enough to kill the virus, it would literally scar the inside of your lung tissue. So it's just there. I'm not sure how that would be useful for anything that we're doing.
Furthermore,
just
you got to
shit.
get into and out of the sauna, and it's a whole lot of damp surfaces and unsanitary conditions.
Right. For something that will definitely not work. Like it's not going to work.
Yep. Corey Elko's asking, we have 1 million hospital beds and 160,000 ventilators. I missed that. Yeah, we did. We talked about that already. It's problematic.
Yep.
Corey had some good news, as there are companies that are working on trying to crank out hundreds of thousands of ventilators per month. This is, like when people make the kind of World War II, we were talking about the World War II analogy. Yes, we're not being asked to storm the beaches at Normandy. We're being asked to sit on the couch and stay home. But you know what? That kind of ramping up production of things that are going to be needed tomorrow is something I'm glad to see. Some companies are thinking about how they're going to meet that demand. And we're going to lose a significant portion of the labor force in all sectors now, not we've been talking a lot about restaurant and hotel and bar employees and musicians, truckers, warehouse workers.
It's going to be everyone.
Factory workers, people that could be producing those things are going to have to be isolated.
So Sue, we actually talked about this earlier. The video was talking about breathing hot air in the sauna. That is categorically not going to work at all. Please tell everyone that comes across this. Every source that I could find has said that is absolutely not going to do anything. So that's important. Yeah, basically, like everything that I've seen, and there's, and I haven't looked into it, so I really want to get into it yet. There's I think it's called hydrochloroquine that can have a potential effect on limiting the number of people that are infected. I saw one doctor talking about it. I actually saw somebody in Canada posting about it. I saw Elon Musk talking about it, but he's been really, really shitty on this, so I don't want to give too much credit to him right now. Mr. fucking this virus is no big deal. He fucking shit the bed on that one. He's busy building rockets, so I'll give him a pass. But yeah, so there's some things that are coming that are possible, good news kind of things. There's actually somebody in Washington State that is testing the first vaccine. She gave herself up as a test dummy, and although she sounds very sharp, just for records. So yeah, there are people mobilizing across all fronts, and we may end up getting good news that way. That's fun. But really, right now is the time for all of us to be thinking about massive overreaction. It's going to feel like overreaction when it's not, and that will save lives. Just period.
And if it's not as bad as we predict, people are going to call us, stupid and chicken littles later. And I'm ready for that, because I've been.
That's the thing.
I've been right about a lot of things so far.
If everyone stays at home, it won't be as bad. And they're like, "Oh, see, we didn't have to stay at home." And I'll be like, "Yep, you understand math," and I'll take it. I'll take the hit. I mean, I don't care what people think about me on a good day.
Yep. Okay.
So yeah,
that was fun.
I'm drinking like all the coffee.
How's the stock market doing?
So other than that, Mrs. Lincoln, it's basically flat.
Oh, it's up.
It's up 1%. That's basically flat in this era. Yeah. That used to be an interesting average day. Now it's just like whatever. That's a pause in the inevitable doom. Yeah, I heard somebody saying today, like, "Hey, is this the bottom? Is this the bottom?" Like, everyone is about to lose their job, dummy. Like, how is this the bottom? That's crazy. Oh,
yeah. Sue, you mean we haven't talked Germany into selling their souls and minds to us for a vaccine? No, the Germans are like 9. Fuck off.
Corey said, "Good news. I'm saving my money to buy stocks in about a year. Chances are the bottom is going to come a lot sooner than that. I think probably 6 months max."
That's good. That's somewhat good news.
Honestly, if Trump was smart, he's not. If Trump was smart, he would never have done this, the Fed stimulus or the bank stimulus, and he would have let it bottom out. Because the sooner it bottoms out, the sooner we get back into a strong position, and he can make the economic argument before November. But he won't,
Gotcha.
And it's not going to work anyway.
Boy, oh boy. What exciting times we're living in.
Right? That whole like Chinese proverb /
never
curse.
Dull.
Fucking never dull.
AccuWeather has an article about COVID-19 reacts very poorly to high temperature, high humidity climates. So there's some good news.
Yeah.
If true.
AccuWeather, asterisk that, because I've heard the exact opposite in the last 48 hours. So, I mean, if it's true, great, but I'm gonna want some experts saying that.
Well, one of the reasons, that
not on the weather, on viruses.
An old truism about viral, about the flu and things like that is, in the summertime, we're not all cooped up together in colder climates. We're not all cooped up together in heated spaces. We're not, we're outside, we're moving around. We're less likely to contract something. But the climate is warmer than it was the last time anybody did kind of baseline research on that. And let's say we have a doldrums, we have a period in the summer where the number of infections goes down. I expect, and everybody else expects, it's going to come roaring back. Now, what it may do is give us enough of of a catch up moment, so that we flatten the curve significantly, and it's not as bad when it comes back in the fall. But I mean, I'm watching other countries already starting to release people from care and loosen restrictions, and I think we're going to see probably some bounce up in the number of cases in places like China because of that. So I don't want us to be, doom and gloom, but I also don't want us to be so optimistic that we forget our heads. We haven't even convinced people to stay inside the first time here yet, and we're already talking about what happens when it gets warm out and everybody can go outside. I think we should be focused on what's going to happen in the next 60 days. Yeah. By the way, hurricane season, 75 days from now.
I mean, that's when everyone's supposed to stay in their houses. So
right. So
until their houses get blown down.
I'm in an evacuation zone. I have to go to a shelter with 500 other people.
They're not going to be able to do that. That's the thing. They're going to have to figure something else out.
There isn't anything else.
Yes, there is. Other people's houses, mandated something, like they're not going to have a choice. Like, to go into a room with 500 people, it could be a death sentence for you. That's not acceptable. That's the thing. Like, they're going to have to do something, and they're going to know it.
Yeah. Well.
Anyway, fucking
my county health department officials start talking about things like that.
Okay, yeah. Everyone in Pasco County is fucked. This is, like, can you imagine the difference if like Kelly and Brandy were freaking on the county commission right now?
Yeah,
because I can.
Yep,
easily. By the way, Sylvester just nailed it. Yeah.
Remember, we'll all be prepped for hurricane season.
You remember when the only thing we had to worry about was Trump being president? Good times.
Good times.
Oh, fucking
nostalgic for we could safely hate Mitt Romney. AccuWeather is a for-profit right-wing company.
That's true.
I hear Wuhan officials saying there isn't enough data yet to make that determination about whether they're.
I'm not against the idea that it could be possible. I'm just seeing experts say that it's not a thing.
Right.
Hey.
Yes. Okay. Yeah, we know, Dave. We know.
No, positive news is good, but again,
are we panic mongering? Is that how you view this? Because I don't feel panicky.
You wouldn't be the first or smartest person to suggest that. So
yeah,
and you're still wrong as far as I'm concerned.
Well, I don't know. I'm feeling sort of fatalistic about my chances of contracting this. I think it's likely that I'll get infected before this is over.
Just stay in your fucking house.
Right. As much as possible.
No, Craig. Stay in your fucking house.
Corey.
Yeah.
We have mental health patients. We have to see. We are medical providers. We are mental health providers. We can't
figure it out.
Not do that.
Figure it out.
Well, we're working on it. On it. Right. But I'm also, going to have to teach a person in their mid-70s how to use Zoom chat and and take payments over the phone. It's going to be difficult.
Yeah.
Right. And we have to actually go to the office for client files to do that part. So in a building that houses a private college that isn't closed yet.
No comment.
Yeah. We're going to do what we can do. We're going to do everything we can do.
Thank you.
Yep. I agree with you about that, Sue. I agree with you about that. And we're giving that way more thought than we want to be at this point. Our friends that do homeless outreach are reducing their contact with people, which doesn't make the people living in the woods feel any better. But it's important. And in fact, I'm going to guess that the homeless population is drastically underinformed right now about what's happening. They're not in front of a TV or a computer monitor for most of the day looking for information. Kaiser University, all campuses still open. That's one of the private colleges, and our building is co-located in a building that houses Kaiser University in our community.
Sylvester said, "Can you meet with them outside in the fresh air, sit several feet away from them, just thinking out loud?" Why not
do that?
Why?
It's against the law.
Fuck the regulations, Greg. I
get what you're saying.
Okay,
but there is no guidance from the state that we are allowed to do that, and we could lose our license to practice forever. So, furthermore, the one place we could have our meetings outside is the smoking area for the entire college, and I'm not going to have a conversation about domestic violence at a table when the kids at the next table can hear everything my clients are saying? How
Yeah.
likely are they to tell the truth about something if other people are listening?
I completely understand what you're saying, and this is the real
So
criminal
we're going to work
aspect.
out a way to teleconference it, and it's not
Right.
going to be as effective, and it's going to get people their completions, but we can't have meetings outside at our current location because
we're just spitballing here. This is the thing that happened with the Ohio governor yesterday, right? He said, "Hey, we're going to postpone the election," and some judges said, "Hey, you're not allowed to do that, like, at all," and he did it anyway, and he was probably right.
Right. Yeah. No. We're seeing clients in an individual setting, in an office, and in a group environment, in a conference room. That's the kind of clients we're serving at this point.
Yeah.
2 groups a week plus probably 20 or 30 individual client appointments for the week, and we're working on it. Okay.
Thank you.
We're working on a
out.
solution, and it may take us a week to put a solution in place. Right.
Yeah.
And you
probably have a week, give or take, maybe.
Yeah. Although we did have somebody come to the door Friday at 5:00 and hand the boss a slip of paper, and he said sorry he was late getting it in, but he'd been feverish and coughing all week after he handed her the paper. So, you dummy. Yeah. Again, we're talking about people that aren't making great decisions in their lives. That's why they're in service with us, right? That's why they're coming to see us. So they are not as aware or making good decisions. When you're depressed, you're forgetful. Things slip your mind. It's one of the symptoms of depression. So there's a lot to this, and like I'm not crying the blues here. Like, we've known for a bit that when something like this happened, we'd have to find a way. But the complications are vast. Like, these are people that are court ordered, and if they don't get completed in a certain time frame, they go to jail, which is actually probably where they will get sick. So we have no guidance from the courts yet on them giving people a pass on meeting deadlines. So we just we're going to do our best to continue to provide services as long as we can. We do know that other places have canceled group environment sessions for now. But they may be treating non-court ordered people. It's a little different when the people are trying to meet court requirements for staying out of jail or getting their children back. So we're concerned, but we're working on some solutions. Boxer Cat, people stayed decent yesterday, but one man did complain to me that I had weighed 8/8 for a patient and had spoken to him while doing so. He said, "So we're making friends now?" He could hear from the lobby. He panicked and envisioned that we were selling out of everything because it does take a minute to weigh multiple strains, as my coworker was also doing. Cheese, but people are mostly good. I think that's her underlying message. You'll work it out. There's a way. Yep, we will. Exercise and fresh air defeats normal depression. That's true, Lori James, but clinical depression is a whole nother animal. And all the exercise and time in the woods is not gonna fix that. That's why they come to see us. So
I can confirm.
Yeah.
Like, I used to
medication plus that, great. But either medication without therapy without medication, not a formula for success.
If it wasn't for ayahuasca, I think I definitely would have ended up on medication coming out of that fucking craziness. It's like something I said I would never ever do. I could not imagine experiencing clinical depression before I had it. That's just.
I know you couldn't.
It's a fucking thing. I know. I think I've apologized for my previous opinions before, but I'll do it again now. It's legit. I was wrong.
I'm proud of you, man. I'm proud of you. Not everybody gets it.
Well, I mean, I wish I got it before.
That's it, but yeah.
Yeah, everyone should get it. Just kidding.
No, please,
not
no.
A thing that it's
Maria
sucks.
Richards, email from Bill Arrakis. Everything is under control. Patting himself on the back because they've passed legislation to stop robocalls. Nice, since I've gotten 4 robocalls this hour. Great job, Gus. Jeez. Yeah. So glad he's fixing the water heater while the roof is on fire. That's great work. Thanks, Gus. Yeah. All right. So what's your day look like? What are you doing? What's happening? Are we going to do the social hour thing this afternoon? 3?
As far as I know.
Okay. That's the Happy Fun Show. We're going to do that on Facebook, not here on YouTube.
Attempted. Yeah.
Yeah.
We'll be on the So Local live page. And yeah, bring any fun memes, anything. Like, obviously, if there's any news updates, we kind of sprinkle that in just because, it's an informational kind of thing. But we're just going to hang out and fucking hang out.
Yeah. Maybe we'll try and play the LHC rap again today without me fucking it up. That'd be
Jesus,
fun.
So terrible. And again, for that one, any of you that would like to join us here in the Zoom, we can handle up to 40 people. We'd be more than happy to host you, in the room. It really just is about like the social distancing is actually just physical distancing.
Right.
The internet, allows us to connect like this, which is why we call it the Stay the Fuck at Home Happy Hour.
Yeah, I mean, internet gamers and Gen X.
I think I just lost you. Merp? It looks like Greg is frozen and I am not. Maybe we just lost him. All right, well, we were kind of wrapping up anyway, so we'll call it. We'll just have Greg's eerie staring face. Sue just said Melissa Etheridge is going to be live at 3 p.m. Did she not check with you about happy hour times? Apparently she did not. Yeah, Greg's stuck. We'll call it. We'll see you guys at 3. Melissa Etheridge can just do her little thing without us, I guess. Or maybe we'll check in with her. Anyway, you guys have an extremely fantastic day. Please be safe. Please let everyone get updated for all of this stuff. Did you change his batteries? Yeah, I should. Oh, sweet. Oh, Jen, thank you so much, Ginny. It's actually Michelle's birthday today, and she loves Dropkick Murphys. So thank you for that. If you see any links for that, please send it to me. I'll Google it as well. Oh, that's awesome. Sherry said John Legend, Keith and Chris Martin are going to live stream performances on social media as well. That's good. I'm glad they're doing that. No, that's fantastic. Anyway, you guys are rad. I will see you guys on the flippity flop.